Hi, it's Dre from Dragon Consulting. I wanted to talk to you in this video about the term interoperability, and in particular, what that term means in the healthcare environment. So we've heard a lot about interoperability in the last year and a half or so, not so much before that. It was around a little bit, but not as prolific as it is now. And a lot of the conversation sort of got spearheaded when the Center of Medicare and Medicaid Services in the US renamed the Meaningful Use Program to be the Promoting Interoperability Program. So on April 24th, 2018, they released a news statement and indicated that they wanted to overhaul the incentive programs to focus more on interoperability. They wanted to relieve some of the burdens that had been there for the electronic exchange and sort of focus on having data flow between providers and patients optimized and much more freely available. So the actual sort of statement that they released is on your screen, and you can sort of read that as we go. So what does interoperability actually mean? So I took a look at the Cambridge Dictionary and found a pretty generic definition, indicating that it's a noun that says basically two products or programs can be used together or have the ability to be used together, which seems great. It's two things connected in some way. The part about this, though, that gets a little confusing is the term degree. And each of the definitions of interoperability that I came across indicates that there is, in fact, degrees of interoperability, stages of interoperability, and that's what I want to chat about today. So the first level of interoperability that we come across in the health environment is what we call foundational. That is basically the connection of two systems for the purpose of exchanging data. So system A is going to send information to system B. System B doesn't need the ability to interpret the information. It doesn't necessarily have to do anything robust or meaningful with it. It just needs to be able to receive it and store it somewhere in that system. So an example of a foundational interoperability scenario would be a PDF document being sent across to a data repository, or a PDF document being sent across to an HIE and listed in a generic bucket of documents. So nothing discrete, just all lands in the same place. The next level is structural interoperability. So this one is a little more detailed. It is, again, information that's passing from system A to system B, but in this case, the information has discrete elements with it when it goes. So it's sent across in a very structured way, and actually is sort of discernible when it gets there. So it can file in specific spots within the second system. So an example of this would be a hospital system, so an EHR, sending information on visit history. So patients, arrivals, outpatient visits, inpatient stays, over to a patient portal. So you can see all of the places that visits have been. So in this particular case, the visit date information is going to file across to a certain discrete field, and the visit reason is going to file across to another. So this would give a general ability in the receiving system of things like sorting by date. The third interoperability category is semantic. So this one, system B, so the receiving system, does have the ability to use the data for functionality within that application. So this is getting much more exciting. The data, again, is discrete as it was in the structural interoperability. But with this particular category, it maintains its purpose and its meaning, and it can be ingested. So an example of this would be lab results that are in a primary care physician's EMR. So lab results that have come across from an outpatient lab visit, so a patient goes to visit an outpatient lab or has some lab work done at urgent care, gets sent over electronically, lands in the physician's EMR, and is actually able to be included in graphs trending the results over time. So not only does it know that it is a lab result, it knows the type of lab result it is, and it can actually incorporate it in with the other lab results that are already in that system. So this is pretty exciting. One thing to note about semantic interoperability it's not simple to set up. So in order to have this level of interoperability, both the sending system and the receiving system need to have codified their data. So they both need to be speaking the same language. They need to know that the sending system CBC is supposed to be a CBC when it lands in the receiving system. So an example of the coding system that I'm talking about is things like LOINC for lab results, SNOMED CT coding for clinical observations, things like that. So that coding has to be in place and has to be attached with the messages when they go across. So the final category of interoperability that we have from a healthcare perspective is organizational. So this incorporates all of the other levels, plus it actually has social meaning and policy attached to it as well. So it's in real time and it's in context. So this is what we really, really want to strive for. It might take us a while to get there, but this is what we're looking to achieve when we talk about the seamless information flow between patients and providers. So an example of this would be patient enters data from a portal or from an application on a mobile device, or data comes across from a personal wearable. And that information is transmitted or exchanged with a receiving system. And the receiving system not only realizes and recognizes what kind of data it is and has the ability to utilize the data, but it also understands what context the data was created in. So whether it was created by a patient or a provider, whether it is an estimate or a defined value, all different sort of aspects around it, what parameters actually came with it. It's able to discern and identify that. Again, all of the information needs to be coded, and there needs to be some pretty discrete data elements that are transmitted across in the messages. But this is the level that we really want to try to get to. And it's going to be a while, but I think we can work towards it. It does require a lot of collaboration as far as defining the standards and making sure we understand both within our own organizations and within our whole health systems sort of what everything means and how we want to break it down. And it also requires quite a bit of work on the actual messaging structures and those technical exchanges, how those occur. So that's where we're headed. And as always, I'll leave you with a quote. This one's from Henry Ford. So coming together is a beginning, keeping together is progress, and working together is success. And I really do think that one day we're going to get there, and I'm hoping it's sooner than later. Thank you.